شمس الدكتورة بتود وصلت؟
صباح الخير، أنا موجودة.
الحمد لله على السلامة.
الله يسلمك، شكرا جزيلا.
Good morning, this is Rafi al-Suwaidi. A pleasant day to everyone presented today. I would like to thank for joining us as we celebrate Breast Cancer Awareness Month this October. Ajmal Free Zone has organized today's event with the main aim of helping increase awarenesses and educating the community about this disease. We would like to personally thank our sponsor for today's event, Fine Healthcare, which is one of the country's primary provider of healthcare products and one of the loyal VIP customer to Ajmal Free Zone. I would like to call on their representative, Dr. Ahmed, to tell us more about Fine Healthcare. Dr. Ahmed, please. اوكي دكتور احمد معانا؟
السلام عليكم.
صوتك وايد واطي.
الو تسمعوني؟
اذا ترفع الصوت اكثر.
طيب صوتك صار واضح؟
شمس الصوت مش واضح؟
لا مو واضح بعده.
Hello, good morning. Can you hear me? The voice is clear now?
يعني شوي أكثر.
شوي أكثر. طيب, okay. I will try
Okay, now it's fine.
Okay, good morning, everyone. It's my pleasure to be with you today. I'm Dr. Ahmed, Marketing Manager for Fine Healthcare Pharmaceutical Factory. It's really our pleasure to be with you, and it will be our it's also our honor to be with you also. Ajmal Free Zone always a big support for us, and also we want to cooperate more as we have community responsibility. Just I want to brief you about my company. We are Fine Healthcare Pharmaceutical Factory based in Ajman Free Zone. We produce medicine as we are certified from Ministry of Health and Prevention. We have a wide variety of products, but before going to that, I would like to just preview about the factory. We produce all our medicine according to the GMP, which is a very high standard specialist for the pharmaceutical products. Also, we have 3 kind of ISO certificates, and all these procedures we are committed to follow this high standard to produce a high and premium product quality. Our history actually, we are in pharmaceutical industry over than 24 years. Our headquarter in Italy. Most our formula products and raw materials brought from Italy. Also the machine also we brought from Italy. The factory actually divided into more than section: quality unit, quality control, production, and the marketing department. For the products, actually, we have 7 scoops. First scoop, it's hospital sanitization and disinfection solution and sanitizers. We provide a hygiene solution for hospital and facilities from A to Z. We provide a hygiene solution for people and also for the environment. That's mean from floor cleaner to the surface disinfectant to the disinfectant which is used by people like hand sanitizer, and also the sanitizer and disinfection used by surgeons for like product chlorhexidine and chlorhexidine scrub. Those products is used before the surgery prepare the skin for operation, and also the surgeon use it before going to the operation. We have the second scope is skincare. We have some products for acne like Hexa and Hexatrans. We have feminine care products starting from the daily hygiene product for females, which contain lactic acid. And also we have products specialized for acute infection. The fourth segment is oral care, which is mouthwashes, hair care for hair loss and anti-dandruff and anti-lice products, baby care starting from shampoo and some lotion. And the last segment is liquid soup. We have a consumer also department for liquid soup, glass cleaner, all those products which is used by consumer. This is a brief on my company. It's my pleasure to be with you today. And we wish the best for Ajman Free Zone and for the other sponsors. Thank you very much.
Thank you, Dr. Ahmed, and thank you once again to Fine Healthcare for sponsoring today's awareness event. Moving on the next part of our program, we have invited Dr. Betul Aboud from our added value partner, Saudi German Hospital in Ajman. She will share with us many insights and experience that we should know about breast cancer. I would like now to call the good doctor to give her talk. Please, Doctor.
Good morning, everyone. Thank you for invited me for today's talk. I'm very glad to be among you today, and I will a new information. I know many people so far they get a lot of information about the breast awareness and screening. So subject, but I hope my presentation will add more information and help more people. I will share my screen now. It's not showing. You can see it? Hello?
لا دكتورة ما يبين.
And I'll try again. And now?
Not yet.
Okay. Okay. Now?
Yeah, now it's okay. Yeah, go ahead.
Okay. Okay. So, good morning, everyone. My name is Batul. I am an oncologist. I'm working right now at Saudi German Hospital, Ajman. We are here today to speak about the awareness of breast cancer because we are now in October, and October, you know, it's the pink month when where everybody speak about breast cancer awareness. So why we are very interested in screening for breast cancer? Why we choose this kind of tumor for screening? Although we have many other screening programs, but breast cancer is like having the more life and the more entrance. I think it's coming from the fact that one of 8 women per year has the incidence of breast cancer, and the deaths reached in USA in 2018 to 41,000 deaths. So I think it's a huge number, especially among the women. And you know, women is like it's represent the 50% of the society, and I think it's her role in the society and families and raising kids and in many parts of society activities. It's important. I think taking care of our women is very important to have a healthy community. But when we start screening for breast cancer since 2006 or maybe earlier, we found between 2006 until 2015 that there is about 1.8% drop or decreasing in the incidence of on the mortality and morbidity of breast cancer after we start using the screening with mammogram and ultrasound. So this is about the Western country or USA. But if we want to talk about UAE, because we are living here, so it's very important to talk about the data in UAE. We found that even though the cancer is the third leading cause of death in UAE, but we found that the breast cancer is the most frequent cancer type in women in UAE, either the citizen female or non-citizen female. And we found also from a data collected from the medical oncology clinic all over UAE that the incidence of breast cancer among ladies takes place 10 years earlier from the ladies in Western countries. And this is, we have to take it in consideration, because if we look at the average age to have breast cancer in Western country, we will speak about the 50. Here we have to speak under 40, and under 40 until now we don't have any screening method. We can't use the mammogram for the patient under 40, so that it's very important to aware the ladies in UAE about the sign of breast cancer, and also educate the patient to how to self-examine themselves. So we have also to speak about the meaning of screening. What we mean by the word screening? Screening, that means perform tests for the ladies, healthy lady. She doesn't complain from anything, just she is healthy and appear healthy, but we screen her to look or to detect an early disease. When we detect the disease earlier, that means we will treat earlier, and so far we will reduce the percentage of mortality and morbidity. I spoke earlier that we have 5 screening programs. Breast is the first one, cervical, colon cancer, and prostate cancer and lung cancer, all they have screening program. But today we will speak only on the breast cancer screening. This is the breast cancer risk factor, but first, before we go to the risk factor, we have to speak about the high-risk population. Who is the woman will have high risk to develop breast cancer? We will speak about the elderly woman, the postmenopausal woman, and the obese woman, and of course, the female gender. We found that breast cancer increased with age from 1 of 49 women at the age of 49 to 1 of 14 women at the age of 70. So breast cancer increased with age. Also, breast cancer increased with postmenopausal status. The frequency of breast cancer in postmenopausal is more than premenopausal. Although here in UAE we found more frequent to have in premenopausal women to have breast cancer, and that from that we have the idea that we have to educate our women to self-examine themselves and educate them about the awareness side of breast cancer. Obesity also on those group of ladies increase the risk of breast cancer, and also we know that breast cancer can happen in male and female, but the female gender increase the possibility of breast cancer. Now this is the risk group of breast cancer, but there is another risk factor increase the breast cancer in other group of women. What is this factor? Mainly we have to focus on the genetic factor, which is the most important risk factor of having a breast cancer. What do we mean by genetic factor? We have the main gene we have to speak about it. It's the BRCA1, BRCA2 gene, which if we have mutation in this gene, that means the incidence of breast cancer and besides the ovarian cancer would increase. This genetic can be inherited. Yani the woman can get it from her mother, or it's like transfer from the family member. Yeah, if the women have any history of breast cancer among her first degree relatives, like mother or sister or the aunt from the mother side, so she has to be more aware of breast cancer, and she has to take care of herself more often and more frequent than the other ladies. The other risk factor is the hormone risk factor. We know that all the women has estrogen. Estrogen is the main hormone in our body, and it's controlling a lot of functions. But if the woman be affected by estrogen without any interruption during her life cycle, that means will increase the incidence of breast cancer. What do you mean that she will be under the effect of estrogen without any interruption? You know, estrogen is increasing every month, and at the middle of your period cycle, this estrogen will drop and your progesterone will continue to rise. If you get pregnant, or if you have breastfeeding, or so this estrogen will continue to be reduced, and the progesterone will be the controller hormone. In case you didn't get pregnant or you didn't have breastfeeding, so the estrogen will continue to increase. So you will be under the effect of estrogen instead of progesterone. In this case, the incidence of breast cancer will increase. So who's those women who have this risk? Women with infertility, or women who get their period very early. Yani the main age to get your period, I think between 13 or 14. But if you get it in the age of 10, that means it will increase the risk of breast cancer. Late menopause, some women, their period will stop at the age of 49, 50. It's different between the countries. But if you still have your period for a long time, longer than 55, maybe that will increase the risk of breast cancer. If you didn't breastfeeding, that means the estrogen will get the control earlier, because during the breastfeeding you have another hormone who will be the controller. But if you didn't, the estrogen will take place. If you have your first child after the age of 30, and so on. So this factor also is important, and those women who have this factor supposed to examine themselves frequently and visit doctors frequently, and screening in this woman group supposed to be mandatory. What else? We have also alcohol, we have smoking, also we have the dense breast. What we mean by the dense breast? If we take two women at the same age and we perform a mammogram for those women, the women which has the most dense breast, this woman will have increase in the risk of breast cancer. Yani if your breast more dense than the other women in your same age group, that means the risk of breast cancer will increase about 5 times. Another data, and it's new published data, shows also the woman who has a night duty or night shift, they have also an increased incidence of breast cancer, and still the reason is under investigation. Also exposed to a treatment radiation. Treatment radiation, that means we have some kind of cancer which called lymphoma, and it may come in very early ages between 10 to 30. And in this kind of lymphoma, we use a treatment called radiation therapy. And if this female receives radiation to her neck or chest place, so this woman will have a risk to increase the incidence of breast cancer later on. Diet. Until now, there is no correlation between the diet and the breast cancer. You will hear a lot of talk about the fat diet and the incidence of breast cancer. But I think still nothing is clear. And we are, as oncologists, focused always on the healthy diet, the balanced diet, and we encourage our women to have exercise frequently. Sedentary life also has the risk to increase the breast cancer incidence. So how we screen and when we have to screen. I think we have 3 main components in screening the program, which is the self-examination, physical examination, and the radiation examination, which is mammogram and ultrasound. We will divide our women to 2 groups. The women above 25 and under 40, and the women above 40. Under 25 and above 25 and under 40, those women, we don't recommend them to do mammogram, because in this age group, mammogram, it will not be accurate. It will not give us an accurate idea what's happening inside your breast, because in this age group, the breast will be very dense. And sometimes the mammogram will mislead you. So in this age group, we'll emphasize on the self-examination. So this lady in this age group is supposed to focus to examine herself frequently every month after 3 to 4 days after when her period will stop, and to visit the doctor once every 1 to 3 years, no more frequent than that. For the mammogram and ultrasound, it's not recommended in this age group. So now if you are older than 40, so here we will speak about the screening program, which we are talking, which we will hear about it, that you have to visit your doctor once in a year, and you have to have your mammogram also once in a year. That if you don't have any risk factor. If the lady has a family history, so this lady is supposed to have her mammogram earlier. And suppose your mother have her breast cancer at the age of 40. So in this case, you're supposed to start your mammogram at the age of 30, yani 10 years earlier from the age that your mother has had her breast cancer. Okay. So I think so. Show the camera. Stop sharing. Open the camera. I think there is some problem in playing the presentation on the screen. I will continue. So 3 components of the screening program: the self-examination, physical examination, mammogram. We will recap it. Above the age of 25 and under the age of 40, we have to focus on the self-examination and visiting your doctor once every 1 to 3 years. Above the age of 40, you have to visit your doctor annually, and you have to have your mammogram as well annually. What we mean by self-examination? Self-examination, this is a very easy examination. You can do it by yourself at home. After your period 4 to 5 days, you will stop in front of the mirror and you have to look at yourself and you have to observe your both breasts and compare between them and to find if there are any difference. You will observe your skin to look after redness or edema or orange-like skin, to see your nipple, if there is a shifted nipple or inverted nipple, if there is any discharge from your nipple, if there is like watery discharge or bloody discharge. Also, some masses can appear while you are looking at your breast. So, after you look at your breast in this position, you have for the second thing is to put your hands on your waist and look again at your breast, and then you have to move your hand above your head and look at your breast. With this movement, if there is something grown, you will find that the both breasts are not similar. There is something different, and this is you have to take it in consideration and visit your doctor earlier. The second step is after observation is to examine yourself. How to examine yourself? You have to lie down and you use your right hand for your left breast and your left hand for your breast. Start pressing on your nipple and move in a circle so you will cover all your breast area until the outer circle of your breast. In this movement or in this touch, you can bulbulate any masses or any lumps that will be in your breast. The masses that we are taking it in consideration, those hard masses fixed to the skin or fixed to the breast tissue, they are not movable masses. So in this case, you have to visit your doctor as early as possible. And this is like, unfortunately, you can see my screen. So now after we spoke about screening and the importance of screening for breast cancer, I think we have to give a brief about the breast cancer. What is breast cancer? Breast cancer is the cancer that affects the breast, and the cell is the same cell of your breast tissue. But those cells, they will start to divide it and increase in size and number for a reason. We spoke about the reason which may hormonal reason or environmental reason or dietary reason or genetic reason. So these cells will get crazy, divide and occupy the place in your breast. So you first sign maybe a masses in your breast. When those cells they are not enough with the place they are living in, they will try to find another places. Breast cancer cells, they like the lymph vessels or the lymph drain, so they will move to your axillary lymph nodes. So sometimes most of our patients with the breast cancer, they have axillary lymph nodes affected. And when they are not enough with those places, they will find another places. So they will move through the blood vessels to another places. They can move to your liver, to your lungs, to your bone, to your brain, wherever they can go. And from this idea, we can divide the breast cancer in 5 stages. 5 stages. The stage 0, the cells is still having their barriers. They didn't broke their barriers. The stage 1, they broke it and they increase in size, but still the size is under the 2 centimeters. When we spoke about stage 2 and 3, that means the tumor started to be more bigger, more than 2 centimeters, and start move to the lymph node of your axillary. In stage 4, that means the cells start to move to other parts of, to other organ in your body, to the liver or to the brain or the bone. It depends. Also, breast cancer can be divided in 2 categories, the hormone positive category and the hormone negative category. And under these 2 categories, we have also another 2 subgroups which depend on the positivity of HER2 and which is a receptor in your breast cancer cell. What about after we divided the breast cancer in a group and we divided in stages? Now we will go to speak about the treatment. The treatment differs from woman to woman. Not all the women will get the same treatment. It depends about the feature of your breast, the stage of your breast cancer. If you are hormone positive, if you are hormone negative, if you have HER2 positive, if you have HER2 negative, if you are stage 1, if you are stage 2, if you are stage 3, or you are stage 4. Not all the lady will receive chemotherapy, and not all the lady will receive hormone therapy. Not all the lady will receive radiation therapy or targeted therapy. That depends on the features of your breast cancer. So you will hear one patient, she received treatment for 1 year. Other patient will receive treatment only for 5 years, 10 years. Others, they will have a treatment for lifelong. The main component in the treatment is the surgery. Whenever we have mass, we like to remove it. When you remove it, the incidence of cure, it will be increased. And this happen only in early stages, in stage 0, stage 1, stage 2, stage 3. But in stage 4, unfortunately, when your cancer spreads all over your body, surgery it will not help. So in this situation, you will have treatment, only treatment, either hormone treatment or chemo treatment or targeted therapy, and it may last for lifelong. So this is the main idea of our talk today. Why we encourage ladies to go and screen? We encourage ladies to go and screen because we want us to discover their cancer as soon as possible. That doesn't mean all the ladies, they will go there and they will find something wrong. No. But there is a percentage of ladies who will visit for a screen, they may find something, and we will discover it very earlier. And when we found the cancer earlier, that means we have the opportunity to treat this cancer, and this patient will be cured. She will go back after a period of treatment with hormone, with chemo, with anything, with whatever. She will go back to her normal life. She will go back to her family, and she will live happily ever after. But when you are afraid and you don't want to go to screen because you don't want to discover that you have something, that means you are letting this something to control your body and to have his place. So treating this cancer in this late stage, it will be very difficult, and you will have to be, maybe you will be cured by the new treatment, maybe, but this treatment cannot be stopped, cannot be held. So you will be under treatment for lifelong. And imagine yourself, you will go to the hospital every 3 weeks or every month to get your medication, and a lot of complications, a lot of side effects. So your quality of life, even you will be affected psychologically. So I think this is the main issue about the screening. Screen yourself, protect yourself, encourage you, be happy to have a healthy life. Don't let the negative thought to affect you and prevent you from going to your doctor because you are afraid. No, because you are afraid, you have to visit your doctor. You have to examine yourself. You have to have your mammogram as early as possible if you are above 40. or if you have a family history, you have to screen yourself earlier. So take care of yourself because your life is matter. And thank you very much.
Thank you, Dr. Batul. It is interesting information. Do anyone have any question or inquiry? Please don't hesitate to ask Dr. Batul. No one? So thank you, Dr. Batul. We have come to the end of the program. And I would like to thank each and everyone for being part of this worthy attempt. The Ajwan Free Zone is forever committed to extending its support to the local community in addressing these timely issues and concerns. Thank you all and good day to all.